Good evening, students. So today I'll be discussing a few histology slides from dental histology. So mostly we'll be discussing the slides from oral mucosa and salivary glands. So today we'll be discussing the slides of oral mucosa and salivary glands, right? Are you guys connected? So let's start with this first slide. In this first slide, we can see the three different types of oral mucosa, right? Orthokeratinized, parakeratinized, and non-keratinized. So these are the three different types of oral mucosa. As you can see in this first diagram, you will notice that there is a thick layer of keratin, right? There is a thick layer of keratin and there are no nuclei in it. But in the second layer, you can notice some flat nuclei here in the superficial or the keratin layer stratum corneum, right? So this again is keratin, but it has nuclei in it. In the third layer, there is no keratin on the surface. As you can notice, there is no keratin on the surface and they are properly visible nuclei. So this is non-keratinized. This is non-keratinized. Here we do not see any keratin, right? And take a note of the stratum basale here. Take a note of the stratum basale. In all these three layers, you can notice that the stratum basale has more prominent nuclei as compared to the other layers. Now, why is that so? Because the stratum basale is actively dividing. Right? Stratum basale is actively dividing layer. And that is why it has more nuclear content in it. It will appear more hematoxophilic. Right? So based on this, when you apply it to the oral pathology, you would notice that initially the normal mucosa, it might show hyperplasia. What is hyperplasia? There is increased division. Right? There is increased division, then we call it hyperplasia. So there is a thickening of the oral mucosa. In that case, it is called hyperplasia. If the epithelial cells, they maintain their appearance, right? If they maintain their normal appearance, that is, they do not appear dysplastic, then we'll call it hyperplasia. What is dysplasia? If they lose their normal resemblance. Dysplasia is also increased division, right? Dysplasia is improper division, right? So the epithelial cells, they might not retain their proper appearance. Then what is carcinoma in situ? Let's say that this is the entire epithelial thickness, right? So within the 1/3, basal 1/3 is known as mild dysplasia. If it involves 2/3, then it is moderate. If it involves more than 2/3, it is severe dysplasia. And if the entire epithelium is involved, right? If the entire epithelium is involved, then it is called carcinoma in situ. So what is the difference between carcinoma in situ and severe dysplasia? It is just that the extreme form of severe dysplasia is carcinoma in situ. But still, as you can see, the basement membrane is intact, right? The basement membrane is intact in carcinoma in situ. When this basement membrane is first breached, then it converts into invasive carcinoma. So that's the application of dental histology and oral pathology. So अगर normal appearance पता है, तो you can easily identify the abnormal appearance. तो normal appearance में हमने क्या देखा? Let's take a bigger picture. Let's take a look at the bigger picture. So this is a magnified diagram of para-keratinized epithelium. So here the epithelium is para-keratinized. You can notice that this keratin filaments, right? You can notice the keratin here, and also you can notice the nuclei in this keratin, isn't it? You can notice the nuclei. So this is para-keratinized epithelium, and as you can see, these cells, they have a definite orientation, isn't it? All these cells, they will appear cuboidal. The basal cells, they appear cuboidal, isn't it? The basal cells, they appear cuboidal, and they appear oriented towards the surface, isn't it? They appear oriented towards the surface. The superficial cells of the stratum spinosum or the suprabasal cells, they are round, and still they all appear oriented towards the surface, isn't it? They do not appear to be haphazardly oriented. They do not appear to be haphazardly arranged. Dysplasia would be indicated by their haphazard arrangement. When there is a haphazard arrangement, it indicates towards dysplasia. Now, also you can differentiate between the epithelium based on the shape and size of these rete ridges. So these epithelial ridges can also help you differentiate between different types of epithelium. For example, non-keratinized epithelium or para-keratinized epithelium, they might show short and thick rete ridges, whereas the masticatory mucosa will show thin and long rete ridges. So masticatory mucosa means, let's say, palate and gingiva. So palate and gingiva will show thin and long rete ridges, right? So let's take a look at the example of hard palate. So this is the hard palate. In the hard palate, let's take a look at the magnified diagram. So this is the magnified diagram of hard palate. Yeah, hard palate hai. This is the orthokeratinized, isn't it? Orthokeratinized epithelium. And how do we say it is orthokeratinized epithelium? Because you can notice the keratin layer here. You can notice the layer of keratin on the surface, and you can see that there is no nucleus, right? There is a lack of nuclei, and therefore we can say that this is orthokeratinized epithelium. So in orthokeratinized epithelium, you would notice that the rete ridges, they are long and they are thin, isn't it? They are thin. All the rete ridges, they are thin. So long and thin rete ridges are seen in masticatory mucosa, whereas short and thick rete ridges are seen in lining mucosa or non-keratinized mucosa. तो ये नॉर्मल एपिथेलियम की बात हुई, केराटिनाइज्ड, नॉन केराटिनाइज्ड, इजंट इट? यहां पर देखो, जैसा कि मैंने पहले भी बताया, द न्यूक्लियाई इन द स्ट्रैटम बेसल, राइट, द न्यूक्लियाई इन द स्ट्रैटम बेसल, they appear large, they appear active, but as we move upwards, these nuclei, or you can say the nuclear to cytoplasmic ratio, it decreases. The cytoplasm content appears to be larger as compared to the nuclear content. तो यहाँ पर देखो, nucleus जो है, it appears small, isn't it? And the cells, they appear more pink, or they appear more eosinophilic, whereas in the basal they appear more hematoxophilic. तो अगर हम इसी को इस तरीके से देखना चाहें कि what would happen if there is a let's say if there is leukoplakia, or if there is leukoedema, or if there is some other pathological process, so what would change in this epithelium? तो अगर हम कहें कि कोई autoimmune disease हो रही है, right, let's say pemphigus है या lichen planus है या कुछ और है, तो what would happen in such a condition? In such a condition, you would see that there is an aggregation of inflammatory cells, right? And where would these inflammatory cells come from? They would come from the connective tissue, isn't it? Connective tissues आएंगे, तो connective tissues से जब वो आएंगे तो सबसे पहले कहाँ जाएंगे? Basement membrane पर, isn't it? At the basement membrane, isn't it? This is the basement membrane. So they would go towards the basement membrane, and you would see a huge accumulation of inflammatory cells at the basement membrane. Now basement membrane पे inflammatory cells aggregate तो हमें malignant situations में भी मिल सकता है, isn't it? तो फिर हम उसको और जो ये ऑटोइम्यून प्रोसेसेस को डिफरेंशिएट कैसे करेंगे? देन वी हैव टू लुक एट दी epithelial cells. We have to look at the epithelial cells. Though it shows acanthosis, यहाँ पर डिवीजन दिख रहा है, यहाँ पर थिकनिंग ऑफ द एपिथेलियम दिख रही है, लेकिन क्या यहाँ पर चेंज न्यूक्लियर साइटोप्लाज्मिक रेशियो दिख रहा है, या क्या यहाँ पर चेंज इन द ओरिएंटेशन ऑफ सेल्स दिख रहा है? इज देयर अ चेंज इन द ओरिएंटेशन ऑफ सेल्स, और इज देयर an increase in nuclear cytoplasmic ratio? ऐसा कुछ दिख रहा है? No, there is no abnormality seen as far as the individual cells are concerned, isn't it? You can still notice that all these cells retain their normal appearance as we have seen in the previous slides, right? So epithelium is normal. It's just that you can see that there is an absence of basement membrane, and the basal layer is getting degenerated. The basal layer is getting degenerated. All this inflammatory cells, they are coming and they are attacking the epithelium. So you can easily differentiate between the inflammatory and the malignant processes, isn't it? If you can notice the cells, if you properly take a note of the cells, they all appear normal, right? These all epithelial cells are appearing normal. Yes, there is a increased division of the cells, so there is acanthosis, but these cells, they appear normal. So there may be hyperplasia, but there is no dysplasia, right? तो एक एग्जांपल अभी हम डिस्प्लेजिया का भी देख लेते हैं. डिस्प्लेजिया से पहले ये है कुछ और, राइट? सो लेट्स सी इफ यू कैन आइडेंटिफाई इट और नॉट. तो व्हाट डू यू सी हियर? द बेसमेंट मेम्ब्रेन, फर्स्ट ऑफ ऑल let's go step by step. So basement membrane is absolutely intact, isn't it? The basement membrane is absolutely intact. Then take a look at the cells. The nuclear cytoplasmic ratio does not appear to increase. It may have actually been decreased, but it hasn't increased. ठीक है? The cells, they appear empty, isn't it? They appear clear. There is a small nuclei and is surrounded by a clear area. So you can see that there is a clearing of the cells. The cytoplasm has become paler, isn't it? The cytoplasm has become pale, isn't it? The nuclei, it does not appear to increase in size, isn't it? And the superficial keratin layer, this also appears to be normal, isn't it? So everything appears normal except for the cytoplasm of the cell, and the cytoplasm appears a bit clear. So which process do you think has taken place here? Let me give you an example, or let me give you some options. So let's say option A is leukoedema, option B is leukoplakia, option C is dysplasia, and option D, let's say inflammation, some sort of inflammation is there, right? Or you can say autoimmune disease, right? तो क्या होगा इसमें? Now leukoedema, it means the cells appear edematous, they appear to have gained some water, isn't it? तो जब हम इसको देखेंगे, तो don't you think that these cells, they appear plump, they appear to have gained some water from the outside, isn't it? They appear to be plump, they appear to have gained some water from the outside, and that's why we can easily say that this is an example of leukoedema. Why not leukoplakia? Because some amount of dysplasia must be visible, isn't it? Leukoplakia should show dysplasia, maybe less than 1/3, maybe more than 1/3, depends on whether it is mild or moderate dysplasia, right? But leukoplakia should show dysplasia. Also, it should show increased keratinization. क्योंकि leukoplakia का clinical appearance कैसा है? It appears white, isn't it? So why does it appear white? Because there is more keratin, isn't it? Dysplasia anyways is ruled out because there is no dysplasia in the epithelium anywhere. And inflammation, autoimmune, there is no inflammatory cell aggregate in the connective tissue, right? There is no inflammatory aggregate in the connective tissue. तो इस तरीके से आप correlate कर सकते हैं, right? So similarly, this is a picture. This is another picture where you can see, where you can visualize the epithelial layer and the connective tissue layer. So what difference do you notice here as compared to the normal epithelium? अगर हम नॉर्मल एपिथेलियम से कंपेयर करें तो यहां पर हमें क्या डिफरेंसेस देखने को मिल रहे हैं? इज एनीवन प्रेजेंट? आज किसी के मैसेजेस नहीं आ रहे? So what difference do you notice in this epithelium as compared to a normal epithelium? तो अगर हम normal epithelium से compare करें, so first of all, it appears to be a parakeratinized epithelium or maybe a non-keratinized epithelium. We cannot say it for sure, but yes, if you take a closer look, you would identify some keratin flecks here, right? Some keratin flecks can be identified here, along with numerous nuclei. So definitely this would have been a para-keratinized epithelium, right? Then, as you would notice that in the parakeratinized epithelium, the nucleus must appear flattened, but here the nuclei, they are appearing round, and not just round, but they appear crowded, isn't it? So nuclei, they are round and they are crowded. So definitely this is not a normal feature, isn't it? It doesn't even look like hyperplasia, because in hyperplasia the normal anatomy or the normal morphology should be maintained, but here it is not normal, isn't it? Then let's go into the deeper tissue. In the deeper tissue, when you go, you would notice something peculiar here, isn't it? And here and here. So what are these things? It appears to be a cell which does not belong to that region, isn't it? It appears to be a cell which does not belong to that region, and this most commonly resembles, or it most likely resembles the superficial cell. So what is the superficial cell doing in a deeper layer? Why has it happened? Because it is a feature of dysplasia. It is representing dysplasia, or you can say it is in the process of forming keratin pearl. So what is keratin pearl? It's nothing. When the cell starts to move upwards, let's say this is the basal cell, normally it should move upwards, isn't it? From stratum basal towards the stratum corneum. But what happens in dysplasia is that the cell loses its path. So while it is going up, it might change its path and move horizontally within the epithelium. And that's why moving outwards with maturation, instead of doing that, it moves laterally as it matures. So you would see individual cell keratinization or keratin pearl formation within the epithelium. So that's why this tissue would resemble the superficial epithelium, isn't it? So ये भी हमें कुछ दिख गया जो कि uncommon है, जाकि not normal, isn't it? It should not be present in that region of the epithelium. Plus, when you take a look at the entire epithelium on a whole, you would notice that more or less all the cells appear similar, right? All the cells, they appear similar from basal to stratum corneum, isn't it? So there is no differentiation. There is no differentiation. Yet some semblance to the epithelium is maintained without the differentiation between the different layers. So the differentiation between the layers is not properly visible here. Stratum corneum, spinosum, granulosum, that is all lost. Inflammation has to be beneath the epithelium, isn't it? So this is inflammation. This is inflammation, right? Within the epithelium, there is no inflammation. Inflammatory cells kaise hote? Connective tissue cells, right? They are seen in the connective tissue. They are not seen within the epithelium, right? So what is happening here is the epithelial cells have lost their normal appearance. Nuclear cytoplasmic ratio has increased, and that is why, Bhavna, you feel like this is the inflammatory cells. These are the inflammatory cells, but these are not inflammatory cells. These are all epithelial cells. Nuclear cytoplasmic ratio बढ़ गया है, और इस वजह से क्या हो रहा है? Abnormal mitosis भी हो रही है. तो आपको superficial layers में mitosis देखने को मिल जाएगी, right? Superficial layers में mitosis देखने को भी मिल जाएगी. So all of this is indicating towards dysplasia. So first thing to notice here is that the entire thickness of epithelium is showing dysplasia. Second, keratin pearls or individual cell keratinization is visible. So these two features are sufficient to say that this is carcinoma in situ, right? This is carcinoma in situ because the entire thickness of epithelium is involved, plus keratin pearls and individual cell keratinization is also visible here. Is it clear? Connective tissue or you can say inflammatory cell infiltrate would always be seen in connective tissue, right? It is not seen within the epithelium. तो नेक्स्ट मेरे ख्याल से तुम लोग थोड़ा सा कोशिश करो इसको समझने का, राइट? सो अगेन कंपेयर इट टू द नॉर्मल एपिथेलियम, राइट? What changes do you see when you compare it to the normal epithelium? Let's start from the superficial layer. So superficial layer means stratum corneum. So what has happened to the stratum corneum or the keratin layer? Has it not increased in thickness? Do you think the keratin layer has increased in thickness? So keratin has increased in thickness, isn't it? So obviously clinical appearance कैसे होगी जब keratin की thickness बढ़ गई तो? It would appear white, right? It would appear a bit white, and you can see inflammatory infiltrate here. थोड़ा सा ये बाहर हो गया पिक्चर के. You can see inflammatory infiltrate here at the basal. So how would you describe this inflammatory infiltrate? It does not appear very dense, isn't it? The inflammatory cells, or you can say the plasma cells, they do not appear very dense here, isn't it? The population appears scarce. So you can say that it is mild to moderate, or properly would say mild. There is mild inflammatory infiltrate, isn't it? Then there is a increase in stratum granulosum also, right? But you can still notice that the stratum granulosum cells, they have a normal semblance, isn't it? They still resemble to the normal stratum granulosum cells, isn't it? तो granules हमें दिख रहे हैं प्रॉपर यहाँ पर. इसके नीचे जो स्पाइनोसम है, they do also appear normal, though their thickness might appear a bit increased. तो यहाँ पर जैसे कि देख रहे हो आप, rete ridges, they appear round, isn't it? They appear round, and there is a lack of cellular polarity. तो यहाँ पर cells को जो आप देख रहे हो, इनकी polarity का loss हो गया है. तो cells का orientation change हो गया है stratum basal में. तो basal में जो orientation है of cells, it is not like the normal epithelium, isn't it? So there is some dysplasia, be it mild. तो mild dysplasia भी है, साथ में there is an increase in proliferation है, both in corneum and in granulosum. Clinically appearance इसकी हम सोच सकते हैं कैसी होगी? It should appear white. So most probably it should resemble which lesion? Leukoplakia, right? तो most probably ये किस lesion की biopsy है? ये है leukoplakia, because it appears white. There is increase in keratin, there is dysplasia, there is mild inflammatory infiltrate, right? So all these features are present. तो नॉर्मल से जब आप कंपेयर करोगे, yes, I'll magnify the slide in the next page and then we can see it, right? So let's take a look at this slide. So what it means is, by lack of cellular polarity, is that all these cells, all the basal cells should be arranged like this on their basement membrane. But imagine if this is the basement membrane and a stratum basal cell is arranged somewhat like this. Other one is arranged like this. Then the third one is arranged like this. Don't you think the polarity or a proper orientation is seen in this first case, and this proper orientation is lacking in the second, because the cells are getting oriented randomly, isn't it? So notice the stratum basal cells here. Some cells are arranged properly, but then other cells are arranged randomly, isn't it? They are arranged randomly. In fact, they appear to be arranged in a circle. But stratum basal is not a circular structure, right? It does not continue within the epithelium, right? It should form the base of the epithelium. It forms the distinction between the epithelium and or the junction between the epithelium and the connective tissue. So all these cells should be arranged on the stratum basal, on the basement membrane. They should have been arranged somewhat like this. But what happens is that these cells are getting disoriented, right? They are getting deoriented. So you can see that some cells are oriented away from the basement membrane. Their bases are away from the, let's say this is the base, and the base is away from this basement membrane, when it should have been arranged on the basement membrane, right? तो जब सेल बेसमेंट मेम्ब्रेन से अलग हट करके कुछ और ओरिएंटेशन हो जाए, हमें प्रॉपर ओरिएंटेशन उसका समझ में ना आए कि पोल्स मतलब सेल्स जो है दे डू नॉट अपीयर टू बी मूविंग फ्रॉम stratum basal to the superficial layer. You can see the cells are randomly distributed, right? These cells are randomly distributed. They do not appear to be arranged in a proper layers from basal to stratum corneum. Is it clear now? Is it clear now? So in this condition, it will be called lack of cellular polarity or loss of cellular polarity. समझ में आ रहा है अब? सो लेट्स गो बैक. तो यहां पर क्या था? देयर इज अ लैक ऑफ सेल्यूलर पोलैरिटी, सो सम अमाउंट ऑफ डिस्प्लेसिया सीन, बी इट माइल्ड और मॉडरेट, accompanied with increased keratin, so we can easily identify it as leukoplakia. Now take a look at this histological diagram. यहां पर हमें क्या दिख रहा है? What can you identify this lesion as? ये किस लीजन की बायोप्सी हो सकती है? ये लीजन क्या हो सकता है? So options are OSCC, leukoplakia, leukoedema and carcinoma in situ. Option A, B, C and D. तो इसको कैसे आइडेंटिफाई करेंगे हम? So let's start from one end. Whichever end you want, you can take. I am taking the left side of this lesion, right? So let's start from one end. Here I can easily notice the stratum corneum. Squamous papilloma, तो बेटा it is not even in the option. And please do not jump to conclusions. When a picture is given to you, please take some time to read the picture, right? So let's do it. Here I can easily notice the stratum corneum, right? And then there is rest of the epithelium, isn't it? But as I move towards the right side, what happens is, first of all, there is a loss of the superficial epithelium, isn't it? The superficial epithelium, which was continuous till here, now it suddenly appears to be missing, isn't it? It suddenly appears to be missing. It appears to be missing in this region. So what we can say is that there is loss of epithelium, and when there is loss of epithelium, what do we describe this region as? We can describe it as an ulcer. So we have an ulcer here. Then again we have epithelium continuity here, isn't it? The superficial layer of the epithelium is again superficial layer, that is stratum corneum in this case, right? Then notice the deeper layers. Don't you think there is an excess of proliferation of the epithelial cells? And look at these epithelial cells. Look at these epithelial cells. Look at these epithelial cells. Can you differentiate the four epithelial cell layers? Stratum corneum, spinosum, granulosum, basal. Can you differentiate them? I don't think it is possible for you to differentiate between these four cell layers. So first of all, it is not a benign condition. It has to be a malignant condition, isn't it? It is not a benign condition because the cellular differentiation has lost, right? The cellular differentiation is lost. So benign condition to nahi hai, malignant condition hai. As you can see, there is an excess of proliferation. Don't you see these epithelial cells in the connective tissue? These epithelial cells, the islands of epithelial cells are seen in connective tissue. दिखा है? यहां से correlate करो. These cells and these cells, they appear same. These cells and these cells, they all appear same. So that means the epithelial cell has proliferated into the connective tissue, isn't it? And when epithelial cell has proliferated into the connective tissue, what does it mean? Also, take a note of the basement membrane. Here the basement membrane appears quite intact and quite discernible, isn't it? यहाँ पर तुम आराम से basement membrane को identify कर पा रहे हो. You can easily identify the basement membrane here. But can you identify any basement membrane in this region? Or in this region? Or in this region? Can you identify the basement membrane everywhere? No. The basement membrane cannot be identified. It is lost here, isn't it? यहाँ पर basement membrane, यहाँ पर जो है basement membrane नहीं दिख रही ना हम लोगों को. Basement membrane appears to be lost in this region, isn't it? What else? Most important thing, and the thing that you should have first looked at, a keratin pearl, isn't it? Can you notice the keratin pearl here? Again, another one can be seen here, isn't it? So some of the keratin pearls can be seen in this lesion as well. So keratin pearls hai, dysplasia hai, and dysplasia is severe, isn't it? There is severe dysplasia from top to bottom. All the cells appear similar. There is lack of cellular differentiation. So dysplasia bhi hai. There is loss of basement membrane and there is proliferation of epithelial cells into the connective tissue. So which of these four lesions would you mark now as your answer? So which of these four options do you think is the correct answer now? Is it OSCC? Is it leukoplakia? Is it leukoedema? और कार्सिनोमा इन सितु, या जैसा भावना ने कहा पहले कुछ और, स्क्वेमस पैपिलोमा शायद कहा था उन्होंने, राइट। तो इसमें से क्या होगा ये? नाउ वी कैन इजीली आइडेंटिफाई इट एज अ डिस्प्लास्टिक मैलिग्नेंट लीजन। तो ये तीनों ही मैलिग्नेंट नहीं है, राइट। विच इज मैलिग्नेंट? इट इज ओएससीसी, ऑप्शन ए। इज इट क्लियर? तो आसान है ना आइडेंटिफाई करना, अगर हम पिक्चर को थोड़ा सा एक बार पढ़ ले तो, ठीक है। अगर आपने सब कुछ नहीं भी देखा, एटलीस्ट टेक अ नोट ऑफ दीज केराटिन pearls, then all the epithelial cells are looking same, and there is a loss of loss of basement membrane, and epithelial cells are seen within the connective tissue. So lot of epithelial cells are seen in the connective tissue, isn't it? Lot of epithelial cells are seen in the connective tissue. So obviously it has to be OSCC. Clear? Now let's take a look at this lesion. What do you think this lesion is? अब इस लीजन में क्या दिख रहा है? चलो थोड़ा सा इसको भी देख लेते हैं, राइट। अगेन देयर इज अ प्रोलिफरेशन ऑफ केराटिन लेयर. Keratin layer appears to be thick. Now what about the rest of the epithelial layers? Do you think there is a proliferation or do you think there is a loss of retiridges? यहां पर retiridges का proliferation दिख रहा है या उनका loss दिख रहा है? So as you can see, the epithelium or the retiridge part appears to be broadened, isn't it? And its depth appears to be very less. The retiridges appear to be very shallow, isn't it? They appear to be very short. So that means there is a loss of retiridges, and the epithelial thickening is also not too much, isn't it? So there is a loss of retiridges, isn't it? Now can you easily identify the differentiation of the epithelial cells? Can you easily identify the 4 different layers? ये stratum corneum है. Then these are the stratum granulosum cells. These cells are the stratum granulosum cells. Then you can easily identify the stratum spinosum, and then at the bottom you can identify the stratum basal cells. So differentiation is maintained, isn't it? Differentiation is still not lost. That is what you can say, isn't it? What else can we notice here? When you go into the connective tissue part, do you notice something different here as compared to the normal epithelium? अगर नहीं याद आ रहा तो एक बार normal epithelium फिर से देख लेते हैं. So this is the normal connective tissue. Though the epithelium appears to be edematous, still we can call it a normal epithelium, right? तो ये normal connective tissue है. इसको देखो, ये normal connective tissue है. इसको भी देखो, right? This is the normal connective tissue. Take a note of how it appears. Again, this is normal connective tissue, isn't it? Here again you have normal connective tissue. तो normal connective tissue कैसा दिख रहा है? Fibrous, cellular या fibrocellular, right? You can decide on that. And once you have decided on that, compare that appearance to this tissue. जो नॉर्मल कनेक्टिव टिश्यू की अपीयरेंस अभी हमने देखी, उससे अब यहां से कंपेयर करो. तो क्या डिफरेंस नोट किया तुमने वहां पर और यहां पर? वहां पर वो कैसे दिख रहे थे? मोर सेल्यूलर और मोर फाइब्रस. और यहां कैसे दिख रहे हैं? मोर सेल्यूलर और मोर फाइब्रस. व्हाट इज द डिफरेंस इन द अपीयरेंस बिटवीन नॉर्मल कनेक्टिव टिश्यू एंड द कनेक्टिव टिश्यू इन दिस पिक्चर? इज देयर एनी डिफरेंस? Here the connective tissue appears more fibrous, isn't it? Here the connective tissue appears more fibrous as compared to the normal connective tissue जो हमने अभी देखा, right? समझ में आ रहा है? तो यहां पर क्या हो रहा है? There is increase in fibers. तो increase in fibers को हम क्या कहते हैं? Fibrosis हो रही है यहाँ पर. And there is an increase in keratin layer, right? There is atrophy of retiridges. So all of these features indicate towards which lesion? Can you identify it now? Bhavna, Shubham, can you identify it? Options अगर मैं दूं तुम्हें, OSCC, OSMF, ल्यूकोप्लेकिया, the either B or C. So what will be your answer? Is it OSCC, OSMF, leukoplakia or either B or C? क्या लगता है क्या होगा? The answer would be, since fibrosis is seen, increased keratin is seen, loss of retiridges is seen, it would be OSMF, isn't it? It would be OSMF. Option B, isn't it? तो इजी है ना आइडेंटिफाई करना. अगर हम नॉर्मल कनेक्टिव टिश्यू मतलब नॉर्मल टिश्यू को एबनॉर्मल टिश्यू के साथ कंपेयर करें, अगर हमें नॉर्मल टिश्यू की अपीयरेंस ध्यान है कि नॉर्मल टिश्यू जो है वो इतना फाइब्रस नहीं होता, ये वाला ज्यादा फाइब्रस दिख रहा है, तो इसका मतलब फाइब्रोसिस हो रही है. नॉर्मल टिश्यू जो है उसमें इतनी सारा केराटिन नहीं दिखता, यहाँ ज्यादा दिख रहा है, इसका मतलब व्हाइट अपीयरेंस भी है. व्हाइट अपीयरेंस है, फाइब्रोसिस है, लॉस ऑफ रेटेरिजेस है, इसका मतलब क्या हो रहा है? एकेंथोलाइसिस हो, इसका मतलब क्या हो रहा है? देयर इज OSMF, isn't it? Less cellular. Very good. Or you could have said more fibrous. Less cellular से ज्यादा more fibrous. कमेंट ज्यादा अच्छा है क्योंकि यहां पर सेल्स का लॉस नहीं है, यहां पर फाइबर्स का एक्सेस है. ठीक है. अच्छा, यहां पर क्या दिख रहा है? वैसे तो मैंने नाम लिखा हुआ दिखाई दिया. अगेन व्हाट डू वी सी हियर? अगेन दिस इज एन एग्जांपल ऑफ सीवियर डिस्प्लेजिया. तो सीवियर डिस्प्लेजिया, जब भी डिस्प्लेजिया होगा देयर इज सम एबनॉर्मैलिटी, एंड व्हेनेवर देयर इज एन एबनॉर्मैलिटी देयर वुड बी अक्यूमुलेशन ऑफ inflammatory cells, right? There would be an accumulation of inflammatory cells. तो यहां पर inflammatory cells आ गए हैं. epithelium भी आप कंपेयर कर सकते हो. You can compare the epithelium at this point with the point B, where the epithelium appears quite normal, isn't it? So when you compare the epithelium at point B with point A, you would notice that at point A, यहाँ पर जो पॉइंट है ये वाला सेक्शन ए, यहाँ पर सारे के सारे सेल्स कैसे दिख रहे हैं? दे आर मोर और लेस सेम इन द एंटायर थिकनेस ऑफ एपिथेलियम, इजंट इट? शुभम, एक्चुअली वो ऑप्शन बी है, OSMF, राइट? इट इज ऑप्शन बी, OSMF. ऑप्शन डी तो आइदर है बी और सी में से, तो इट इज ऑप्शन बी, OSMF. इट इज नॉट ल्यूकोप्लेकिया, राइट? क्योंकि यहां फाइब्रोसिस है. डी नहीं शुभम, बी. तो यहां पर क्या हो रहा है? यहां हमने सीवियर डिस्प्लेजिया देखने की कोशिश की. तो एक जगह हमने कार्सिनोमा इन सितु देखा. कार्सिनोमा इन सितु और सीवियर डिस्प्लेजिया में क्या फर्क है? इतना ही कि मोर देन 2/3 है तो सीवियर डिस्प्लेजिया, और अगर एंटायर थिकनेस है तो कार्सिनोमा इन सितु. सो सीवियर फॉर्म ऑफ सीवियर डिस्प्लेजिया इज कार्सिनोमा इन सितु, राइट? Severe form of severe dysplasia is carcinoma in situ. ठीक है. So here what you notice is that there is no break in the basement membrane, isn't it? There is no break in the basement membrane, just like the normal epithelium. तो कोई ब्रेक नहीं है बेसमेंट मेम्ब्रेन में. प्लस all the cells they appear same, isn't it? All the cells appear same. There is a loss in the differentiation of the cellular levels, isn't it? तो यहां पर हम क्या कह सकते हैं इजीली कि ये सीवियर डिस्प्लेजिया तो है ही है, क्योंकि ये पिक्चर कैसे दूर से ली हुई है ना, zoomed out पिक्चर है. तो यहां पर आप पूरी की पूरी डिटेल तो मेक आउट नहीं कर पा रहे, तो सेफली यू कैन से दैट दिस इज सीवियर डिस्प्लेजिया. यहां अगर केराटिन पर्ल है नहीं है हमें नहीं पता. इट माइट बी प्रेजेंट, इट माइट नॉट बी प्रेजेंट. So we can safely say that this is severe dysplasia. तो severe dysplasia तो है ही है. It might be carcinoma in situ. ठीक है. अगर दो ऑप्शन आ भी जाते हैं इस पिक्चर के साथ, अगर इस पिक्चर के साथ ये दो ऑप्शन आ भी जाते हैं, OSMF, carcinoma in situ and severe dysplasia, right? तो इसमें हम इजीली सीवियर डिस्प्लेजिया को मार्क कर सकते हैं, राइट? इसमें हम इजीली सीवियर डिस्प्लेजिया को मार्क कर सकते हैं. क्यों? क्योंकि हमें इसमें इतनी लो मैग्निफिकेशन पे देख करके ये नहीं पता कि एंटायर एपिथेलियम इन्वॉल्व है या 2/3 से ज्यादा इन्वॉल्व है. पहली बात. दूसरी बात, इसमें कोई केराटिन पर्ल्स है नहीं है, हमें वो भी नहीं पता क्योंकि ये बिल्कुल लो मैग्निफिकेशन पे है. बट स्टिल मेकिंग आउट द ओवरऑल appearance of this area, we can say that yes, there is dysplasia and it involves more than 2/3 of the epithelium. तो सीवियर डिस्प्लेजिया तो है ही है, कार्सिनोमा इन सितु हो सकता है. So it has a chance of being there, but the chance is low, isn't it? तो दोनों ऑप्शन भी सही हो सकते हैं, बट बेहतर ऑप्शन कौन सा है? सीवियर डिस्प्लेजिया. इज इट क्लियर? तो हमने सीवियर डिस्प्लेजिया क्यों कहा? क्योंकि ये लो मैग्निफिकेशन का है डायग्राम, इसमें हम ज्यादा नहीं देख पाते, जितना हम दिख रहा है उसके हिसाब से हम सीवियर डिस्प्लेजिया बोल रहे हैं. नेक्स्ट हमने ये डायग्राम तो डिस्कस कर ही लिया था. एक डायग्राम मैं ये और बताना चाह रहा था, बिकॉज समटाइम्स क्वेश्चन में बी आस्क्ड वेदर the cellular epithelium has red ridges or not, right? So what do you say, cellular epithelium has red ridges or not? Cellular epithelium. So do you think they are present or absent? What do you think about the red ridges in cellular epithelium? Are they present or are they absent? So as you can notice here in this diagram, थोड़ा सा मैग्नीफाई अगर कर दें इसको, अगर हम इसे थोड़ा सा मैग्नीफाई कर दें, so what would you notice? ऑप्शन सी तो कुछ है ही नहीं. शुभम, अच्छा ऑप्शन सी प्रीवियस क्वेश्चन में जहां पर हमने कार्सिनोमा इन सितु और सीवियर डिस्प्लेजिया पूछा था. यस, देयर ऑप्शन सी, सीवियर डिस्प्लेजिया इज करेक्ट. बट व्हाट अबाउट दिस? व्हाट अबाउट दिस पिक्चर? Cellular epithelium, does it have red ridges or not? Does the cellular epithelium have red ridges or not? Yes or no? So the answer is yes. They do have red ridges, and in fact the red ridges in cellular epithelium are longer as compared to the red ridges of gingiva, right? तो gingival adjacent gingival epithelium से भी ज्यादा elongated red ridges मिलते हैं हमें cellular epithelium में, right? Yes, and they are elongated. How do they appear? They appear elongated. They are elongated, right? So cellular epithelium में red ridges होते हैं and they are elongated, longer than the red ridges of the adjacent gingiva, right? तो अगर कोई आपसे ये कहता है कि cellular epithelium does not have red ridges, it has a smooth connective tissue epithelium interface, तो वो गलत है. Smooth epithelium connective tissue interface केवल एक ही जगह होता है और that is junctional epithelium, right? In the junctional epithelium, this is the only epithelium which has a smooth connective tissue epithelium interface. That is the basement membrane is absolutely straight. ठीक है, तो ये चीज ध्यान रखना. Cellular epithelium has red ridges and they are elongated. तो यहां पर हमें क्या दिख रहा है? What do you see in this diagram? What do you see in this diagram? तो इस डायग्राम में हमें क्या देखने को मिल रहा है? We have several units, right? We have several lobules. We have several lobules. So we can say that this is a secretory. These are secretory units, right? Then what you can notice is round nuclei. ठीक है ना? क्या दिख रहा है हमें? Round nuclei दिख रहा है हमें, right? The nuclei is round. So this is secretory. This is some sort of secretory tissue. The nuclei is round and the cell, it appears to be granular, isn't it? The cell appears to be granular. It does not appear translucent, right? It does not appear translucent. ठीक है, तो translucent तो नहीं है ये. It appears opaque. It appears granular. So cytoplasm appears granular. Cytoplasm appears granular. Nucleus is round, isn't it? And it has an acinic structure. तो acini दिख रहे हैं ना हमें यहाँ पर, secretory acini. Secretory acini, round nucleus, granular cytoplasm. All of this indicates towards serous acini, isn't it? All of this indicates towards serous acini. तो ये कौन सा acini है? ये serous acini. And since we can see only and only serous acini, है ना, only and only serous acini are seen. Mucous acini तो कहीं दिख ही नहीं रहा हमें इसमें. That's why we can say that this tissue most probably is parotid gland. तो एसिनिक डक्ट नहीं है, ये पैरोटिड ग्लैंड है. ठीक है, जो डक्ट थी उसको तो हमने मार्क भी नहीं किया है अभी तक. These are the ducts. These are the ducts, isn't it? These are the ducts. तो इसमें कौन सी डक्ट्स दिख रही हैं तुम्हें पता है थोड़ा? Now take a look at this round duct. ठीक है, here all the nuclei appear to be towards the base, isn't it? They all appear towards the base. So most probably this is the intercalated duct. Most probably this is the intercalated duct. But what about this larger duct? Here the nucleus appear to be away from the basement membrane, and most probably this is the striated duct. Is it clear? Most probably this is the striated duct. क्यों striated duct? क्योंकि न्यूक्लियस बेसमेंट मेम्ब्रेन से अवे है. ठीक है, और यहाँ पर बेसमेंट मेम्ब्रेन के पास है, इसलिए ये इंटरकैलेटेड डक्ट है. राइट, नाउ यू कैन ऑल्सो सी सम क्लियर सेल्स हियर. क्लियर सेल्स दिख रहे हैं यहाँ पर कोने में थोड़े से. सो व्हाट आर दीज क्लियर सेल्स? मोस्ट प्रोबेबली दीज क्लियर सेल्स आर नथिंग बट दी फैट सेल्स. क्या है ये? फैट सेल्स. राइट, आगे बढ़ते हैं. ये वापस से एक सलाइवरी ग्लैंड ही है, एंड इनफैक्ट सलाइवरी डक्ट यहां पर मार्क भी किया हुआ है. So what do you think about this salivary gland? What type of salivary gland do you think this is? Is it a mixed salivary gland, or is it a pure mucous salivary gland, or do you think this is a serous salivary gland? क्या लगता है ये कैसा है? सीरस है, मिक्स्ड है, या mucous salivary gland है? What type of salivary gland do you think this is based on this histologic diagram? यहां पर भी हमें वैसे ही बहुत सारे एसिनिक स्ट्रक्चर्स दिख रहे हैं ना, बहुत सारे सिक्रीटरी यूनिट्स दिख रही हैं हमें यहाँ पर. वी कैन सी लॉट ऑफ सिक्रीटरी यूनिट्स अलोंग विद द डक्ट. मार्क किया हुआ है, यहाँ पर भी एक डक्ट है. राइट, सो व्हाट डू यू थिंक this picture indicates towards? Is it a picture of a serous salivary gland, a mixed salivary gland, or a mucous salivary gland? तो ओवरऑल भी अगर तुम इसको देखो तो तुम्हें कुछ जगह पर क्या दिख जाएगा? यहां पर सीरस है, ये सीरस है, सीरस सीरस सीरस, isn't it? And then there are some mucus, ये mucus. ठीक है, there is lot of mucus with some serous. So whether the serous is more or the mucus is more, when both of them are present, it obviously means that this is a mixed salivary gland, isn't it? क्योंकि यहाँ पर mucus भी दिख रहा है, serous भी दिख रहा है. ये उसी का एक मैग्नीफाइड पोर्शन है जिसमें कि हमने म्यूकस वाले पोर्शन को ज्यादा देखने की कोशिश की है. नाउ वी हैव आइडेंटिफाइड द सीरस ग्लैंड्स. हाउ डू यू आइडेंटिफाई द म्यूकस एसिनाई? राइट, सीरस एसिनाई तो हमने आइडेंटिफाई कर ली. ग्रैन्युलर साइटोप्लाज्म दिख रहा था, राउंड न्यूक्लियस थे. राइट, बट व्हाट अबाउट द म्यूकस? म्यूकस में जैसा कि तुम देख रहे हो यहाँ पर जो सेल्स हैं, दे अपीयर अ बिट ट्रांसलूसेंट. दीज सेल्स अपीयर अ बिट ट्रांसलूसेंट, isn't it? ये सेल्स कैसे लग रहे हैं? थोड़े ट्रांसलूसेंट से लग रहे हैं. एंड द न्यूक्लियाई आर फ्लैटेंड, isn't it? द न्यूक्लियाई आर फ्लैटेंड. तो न्यूक्लियाई फ्लैटेंड है, सेल जो है पूरा का पूरा ट्रांसलूसेंट सा दिख रहा है. दैट मीन्स इट इज अ म्यूकस सलाइवरी ग्लैंड और म्यूकस सलाइवरी और म्यूकस सीक्रेटरी यूनिट. ऑल्सो यू कैन सी हियर देयर इज अ कैप ऑफ serous unit over the mucous unit. So this is nothing but the serous demilume. Right, this is nothing but the serous demilume, which is again seen in the mucous glands. Right, अब यहां पर कुछ आप देख सकते हो. These are serous gland, serous units. Right, these are serous units. Here these are serous units. All these are serous units. तो सीरस भी इसमें दिख रही है, म्यूकस भी इसमें दिख रही है. सीरस आइडेंटिफाई करना आसान है, isn't it? They all have round cells. दे ऑल हैव राउंड न्यूक्लियाई, सॉरी नॉट सेल्स, दे ऑल हैव राउंड न्यूक्लियाई, प्लम्प न्यूक्लियाई हैं। जबकि जो म्यूकस ग्लैंड्स हैं, जो म्यूकस यूनिट्स हैं, उन सब में न्यूक्लियाई आर फ्लैट। इज इट क्लियर? तो इस तरीके से आप डिफरेंशिएट कर सकते हो। साइटोप्लाज्म का कलर भी आप देख सकते हो, साइटोप्लाज्म अपीयर्स पेल और इट अपीयर्स ट्रांसलूसेंट, whereas in the serous units it appears granular, it appears dark, it appears opaque, right? तो ये एक और उसी का स्ट्रक्चर है मिक्स्ड salivary gland का, right? Again you can see a salivary duct here. This is the salivary duct, and most probably it is the striated duct because the nucleus they appear away from the basement membrane. एक और एग्जाम्पल है, ये और ज्यादा बेहतर एग्जाम्पल है मिक्स्ड वाले का, क्योंकि पीछे कहीं भी हमें मिक्स्ड में उतना ज्यादा सीरियस नहीं दिख रहा था। यहाँ पर जो रेशियो है सीरियस और म्यूकस का, दैट इज अ बिट बेटर, राइट? तो इसलिए मैंने एक और पिक्चर ले लिया था ये। इसके अंदर आपको मिक्स्ड और सीरियस, यहाँ पर देखो अभी हम सब उसी में चल रहे हैं। all these histological diagrams are of mixed mucous and serous salivary glands, isn't it? तो यहाँ पर आप देख सकते हो flattened nucleus, ये देखो इधर flattened nucleus है, दिख रहा है flattened nucleus सारा, ये सब flattened nucleus है। wherever the cytoplasm appears lighter in color, that is mucous gland और mucous unit, और जहां भी mucous unit दिखेगी वहां पर आपको cells flattened दिखेंगे। कहीं भी देखो आप, यहां पर देख लो, इधर देखो, और everywhere nuclei are flattened, everywhere nuclei are flattened. So wherever there is mucous unit, nuclei are flattened because the mucus that is building up in the cells, it compresses the nuclei, right? And it also expands the cellular boundary, ठीक है? But that is not so in the serous units. तो वहां पर जो न्यूक्लियस है वो हमेशा राउंड रहेंगे, वो हमेशा कैसे रहेंगे? राउंड रहेंगे। And there is an aggregation of protein or the transport vesicles which are containing proteins, isn't it? तो वो zymogen granules जो है उनके accumulation की वजह से cytoplasm appears granular, isn't it? तो जो serous cells हैं उसमें granular cytoplasm दिखेगा, dark दिखेगा, जो mucus है उसमें light color का दिखेगा, translucent सा दिखेगा, nucleus will be flat। क्या आप समझ में आ गया भावना? यहां देखो ये न्यूक्लियस कैसे कंप्रेस्ड है, ये देखो ये न्यूक्लियस, it is very compressed towards the boundary, isn't it? The nucleus appears compressed towards the boundary. कहीं पर भी देख लो, यहाँ पर, यहाँ पर, यहाँ पर, isn't it? Everywhere, here, everywhere the nucleus appears to be compressed towards the boundary, isn't it? तो आई होप ये सब समझ में आ रहा है। ये एक डायग्राम है टंग का, as you can notice from this marking, that is taste bud। तो ये किसका है? टंग, dorsal surface of tongue। तो dorsal surface of tongue है, और यहां पर हमने क्या circumvallate papillae लिया है, circumvallate papillae। तो on the circumvallate papillae the taste buds are located on the lateral surfaces। तो ये आप देखो जो lateral surface है इसकी, इस यहाँ पर you will see small discontinuity of the epithelium, sort of ऐसे discontinuity जैसा appear होगा, और depressions appear होंगे। So these depressions are nothing but the taste buds, right? And beneath the taste bud, beneath the lingual papillae, you will notice these glandular structure once again, isn't it? अब तो मेरे ख्याल से आसानी से आइडेंटिफाई कर पाओगे, ये ग्लैंडुलर स्ट्रक्चर दिख रहा है, ग्लैंडुलर स्ट्रक्चर जो हमने अभी अभी मिक्स्ड एसिनाइज देखे थे, जो अभी हमने म्यूकस एसिनाइज देखे थे, क्या वो म्यूकस एसिनाइज जैसे अपीयरेंस नहीं आ रहा है? यहाँ पर ट्रांसलूसेंट से सेल्स हैं, न्यूक्लियाई इज नॉट सीन प्रोमिनेंटली, मे बी इट इज फ्लैटेंड एंड दे अपीयर इन क्लस्टर्स, राइट, एग्रीगेट्स। तो क्या लगता है कि ये ग्लैंडुलर स्ट्रक्चर है या नहीं है? सेम अपीयरेंस है ना ऐसी ग्लैंडुलर स्ट्रक्चर, जैसे ये ग्लैंड्स जैसे हैं इधर, जैसे ये अपीयरेंस है, सेम ऐसी ही अपीयरेंस यहां पर भी आ रही है इन सब की। तो what do you think are these structures? These are nothing but the minor salivary glands, right? These are nothing but the minor salivary glands। और यहां पर सब क्या है? दे हैव अ इंफ्लेमेटरी सेल अपीयरेंस, इजंट इट? प्लाज्मा सेल्स नहीं होते, जैसे प्लाज्मा सेल्स हैं, सो मेनली प्लाज्मा सेल्स में क्या होता है, न्यूक्लियस ही न्यूक्लियस होता है, साइटोप्लाज्म बहुत थोड़ा सा होता है, एंड दैट्स व्हाई दे अपीयर हेमेटोक्सोफिलिक, इजंट इट? दे अपीयर ब्लू इन कलर। तो यहां पर ऐसे ब्लू सेल एग्रीगेट है, तो व्हाट इज दिस? दिस इज नथिंग बट द लिम्फोइड एग्रीगेट और लिम्फोइड टिश्यू, लिम्फोइड टिश्यू। तो इस तरीके से आप लिम्फोइड टिश्यू भी आइडेंटिफाई कर सकते हो, आप ग्लैंडुलर सेल भी आइडेंटिफाई कर सकते हो, और बीच में ये क्या है, दिस इज मसल, राइट? दीज आर दी मसल्स, दीज आर दी मसल्स, इजंट इट? तो इस तरीके से आप 3-4 टिश्यूज इसमें आइडेंटिफाई कर सकते हो। ग्लैंडुलर स्ट्रक्चर तो मेरे ख्याल से बहुत आसानी से आइडेंटिफाई कर लोगे। जो प्लाज्मा सेल जैसा दिख रहा है, दैट इज ऑल लिम्फोइड टिश्यू, जहां पर डार्क ब्लू सेल्स दिख रहे हैं, राइट? दैट इज ऑल लिम्फोइड टिश्यू। अब इसी को थोड़ा सा मैग्नीफाई करके देखते हैं। सो दिस इज द सर्कमवैलेंट पैपिले, राइट? दिस इज द सर्कमवैलेंट पैपिला, and on the walls of the circumvallate papillae you can easily identify the taste buds. Here you can easily identify the taste buds, isn't it? तो इसके नीचे ये जो ग्लैंडुलर स्ट्रक्चर है, ये भी थोड़ी सा मैग्नीफाई होकर के दिख रहा है। नाउ यू कैन better identify the glandular structure, this minor salivary glands you can better identify. So we know that minor salivary glands are associated with the circumvallate papillae. Which minor salivary glands are associated with circumvallate papillae? Von Ebner glands, isn't it? Von Ebner glands, they are associated with circumvallate papillae, isn't it? इसी को थोड़ा और मैग्नीफाई करके देख लो, और मैग्नीफाई करेंगे, now you can easily visualize the glandular structure and these plasma cells, isn't it? Large blue nuclei दिख रहा है ना हमें लेफ्ट साइड में, so these are what? These are inflammatory cells, these are lymphoid tissue, और राइट साइड में हमें क्या दिख रहा है, यहाँ पर glandular structure, these are minor salivary glands. क्लियर? इसी स्ट्रक्चर को हमने और ज्यादा, क्योंकि पीछे मैं तुम्हें एडिपोज टिश्यू के बारे में बता चुका हूं, तो ऑल दीज सेल्स वेयर ओनली बाउंड्री ऑफ द सेल इज सीन बट द साइटोप्लाज्म अपीयर्स ट्रांसपेरेंट. व्हाट आर दीज सेल्स? दीज सेल्स आर नथिंग बट द फैट सेल्स, इजंट इट? दे आर नथिंग बट द फैट सेल्स. क्लियर है? क्या कोई डाउट है? शुभम, भावना, कोई डाउट? आगे बढ़े तो सर्कमवैलेंट पैपिले डिस्कस किया। सर्कमवैलेंट पैपिले के बाद यह है फिलीफॉर्म पैपिले। फिलीफॉर्म पैपिले, फिलीफॉर्म पैपिले की सबसे खास बात क्या होती है? दीज आर दी ओनली लिंगुअल पैपिले विच आर keratinized, isn't it? So that's why you can see a layer of keratin covering these papillae, isn't it? There is a layer of keratin covering these papillae, and that's why they are keratinized papillae, and they lack taste bud. They lack taste bud, and they appear hair-like extension. ऐसे spiky सी extension दिखती है, right? So that's why they appear to be hair-like, and that's why they are known as filiform papillae. यहां पर ये क्या दिख रहा है? ये खूब सारा इन्फ्लेमेटरी इन्फिल्ट्रेट, isn't it? इन्फ्लेमेटरी इन्फिल्ट्रेट, तो बायोप्सी लिए कोई ना कोई रीजन तो रहा होगा, तो दैट्स व्हाई देयर इज एन इन्फ्लेमेटरी इन्फिल्ट्रेट। कुछ वजह रही होगी, ट्रॉमा या अल्सर या कुछ भी। सो दैट इज ऑल फॉर टुडे। आज के लिए इतनी स्लाइड्स थी। क्या इसमें कुछ डाउट है? भावना ने एक सवाल पूछा था एंगुलेशन ऑफ टीथ पर, तो अगर इस स्लाइड्स में कोई डाउट नहीं है तो मैं एंगुलेशन ऑफ टीथ एक बार फटाफट से बता दूंगा। सो डू यू हैव एनी डाउट इन दीज स्लाइड्स? तो एक बार एंगुलेशन की तरफ चलते हैं वापस से। कल हमने डिस्कस किया था एंगुलेशन के बारे में, राइट? एंगुलेशन के बारे में हमने कल डिस्कस किया था। तो एंगुलेशन अगर आपसे पूछते हैं, तो इट वुड बी आइदर मीजियोडिस्टल एंगुलेशन और फेशियोलिंगुअल एंगुलेशन। तो मीजियोडिस्टल एंगुलेशन की सबसे पहले बात कर लेते हैं अपन, है ना। मीजियोडिस्टल एंगुलेशन, सो विच टूथ हैज मैक्सिमम मीजियोडिस्टल एंगुलेशन इन ह्यूमन डेंटिशन? बहुत आसान है, थर्ड। तो दिस इज द मैक्सिमम, अपर कनाइन हैज मैक्सिमम मीजियोडिस्टल एंगुलेशन। और मिनिमम किसका है? मोस्ट अपराइट मीजियोडिस्टली, इट इज लोअर लैटरल इंसाइजर, राइट, लोअर लैटरल इंसाइजर। तो लोअर लैटरल इंसाइजर इज द मोस्ट अपराइट। अगर आपसे क्वाड्रेंट एक पर्टिकुलर आर्च में पूछ रहे हैं कि विच इज मोस्ट अपराइट इन मैक्सिला और विच इज मोस्ट इंक्लाइंड इन मैंडिबल, तो क्या होगा? मीजियोडिस्टल एंगुलेशन का हमेशा ध्यान रखना, मैंडिबल में एंटीरियर टू पोस्टीरियर बढ़ता है, ठीक है, मैंडिबल में एंटीरियर टू पोस्टीरियर मीजियोडिस्टल एंगुलेशन बढ़ता है। तो जो सेकेंड मोलर है इस टेबल में तो वो दिखेगा, बट सेकेंड मोलर से भी ज्यादा थर्ड मोलर का मीजियोडिस्टल एंगुलेशन होता है, राइट। सो मीजियोडिस्टल एंगुलेशन इंक्रीजेस इन मैंडिबल एज यू मूव डिस्टली। तो थर्ड मोलर का मैक्सिमम होगा, एंटीरियर्स का मिनिमम होगा। अब इस सीक्वेंस में चलें तो 1 का मिनिमम होना चाहिए था, बट मिनिमम किसका है? लैटरल इंसाइजर का। तो वो थोड़ा बहुत एक्सेप्शन होता है, राइट। अपार्ट फ्रॉम दैट यू वुड नोटिस दैट द मीजियोडिस्टल एंगुलेशन इंक्रीजेस डिस्टली इन मैंडिबल। मैक्सिला में क्या है? मैक्सिला में मैक्सिमम इज इन दी canine, isn't it? Maxilla में maximum is in the canine and minimum is in the central incisor. तो अगर ये दो एक चीज भी याद रह गई तो sufficient है। Which is the most upright tooth mesiodistally in maxilla? It is the incisor and same is with the mandible. ठीक है, mandible हो चाहे maxilla हो, mesiodistally most upright कौन से होंगे? incisors, क्योंकि हम नहीं चाहेंगे कि incisors हमारे टेढ़े मेढ़े या deviated हमें दिखे, right? We want them to be straight, isn't it? So the most mesiodistally upright teeth in any arch would be incisors. तो most upright कौन सा incisor है? Lower lateral. और most inclined mesiodistally inclined tooth कौन सा है? Upper canine. Mandible में कौन है? Third molar. Is it clear? तो ये सिंपल सी चीजें हैं, है ना, इसमें ज्यादा कुछ रटने की जरूरत है ही नहीं, सिंपल है। जैसे जैसे हम पीछे जाएंगे मैंडिबल में वैसे वैसे इंक्लिनेशन बढ़ेगा। मैक्सिला में एवरीथिंग इज इन द इंटीरियर्स, मोस्ट अपराइट इंसाइजर्स हैं, मोस्ट एंगुलेटेड कनाइन है, दैट्स इट। बाकी पीछे के बारे में कुछ सोचना ही नहीं है। समझ में आ रहा है? अब अगर हम फेशियोलिंगुअल इंक्लिनेशंस की बात करें तो फेशियोलिंगुअली भी सिंपल है। फेशियोलिंगुअल इंक्लिनेशन सबसे ज्यादा इंटीरियर्स का है, मैक्सिमम फेशियोलिंगुअल इंक्लिनेशन इज ऑफ इंटीरियर्स एंड मिनिमम फेशियोलिंगुअल इंक्लिनेशन इज ऑफ प्रीमोलर्स। तो यहां पर जैसा कि आप देख सकते हो, anteriors, that is incisors, not exactly anteriors, incisors. Incisors have the maximum faciolingual inclination and premolars have the minimum faciolingual inclination. Is it clear? जो मिनिमम फेशियोलिंगुअल इंक्लिनेशन होगा वो किसका होगा? इंडिविजुअल आर्चेस के अंदर। मैंडिबल में भी मिनिमम किसका है? प्रीमोलर्स का। और मैक्सिला में भी मिनिमम किसका है? प्रीमोलर्स का। सो प्रीमोलर्स आर दी मोस्ट अपराइट फेशियोलिंगुअली, right? They are most upright faciolingually and incisors are most upright mesiodistally, but incisors are most inclined faciolingually. Is it clear? Now faciolingual inclination maximum incisors का, but mesiodistal minimum incisors का, ठीक है। तो रटने वाली कोई चीज है ही नहीं। incisors कैसे हैं? सीधे आते हैं लेकिन labially inclined है, ठीक है। So which tooth is lingually inclined? Again, just like mesiodistal inclination, faciolingual भी sequential है mandible में। incisors में सबसे ज्यादा facial inclination है, पर जैसे जैसे आप distally move करोगे lingual inclination बढ़ता जाता है। So mandibular third molar has maximum lingual inclination. Apart from mandibular molars, all the other teeth have a facial inclination or they do not show any inclination, ठीक है। but lingual inclination only and only mandibular molars में ही है, ठीक है। समझ में आ रहा है? Is it clear? भावना, शुभम, is it clear? तो मैक्सिमम इंक्लिनेशन फेशियोलिंगुअली किसका हो गया? अपर सेंट्रल का। अपर सेंट्रल फॉलोड बाय अपर लैटरल and then lower lateral, then lower central. So this is the sequence for faciolingual inclination. Premolars are the most upright. But मैंने कल एक बात और कही थी, though the lower premolar has an angulation of about 9 degrees, right? It has an angulation of about, तो वर्टिकल से अगर हम बात करें, ये वर्टिकल है, तो यहां से अगर हम बात करें तो it has an angulation of 9 degrees, but then its crown is inclined on its root. The crown is inclined on its root, and because of that the crown has an angulation of 30 degrees. Is it clear? तो क्राउन एंगुलेशन लोअर प्रीमोलर में मैक्सिमम है 30 डिग्रीज, लोअर फर्स्ट प्रीमोलर, और इसीलिए आपको एंडो में सवाल आता है कि आपको बर को टिल्ट करना पड़ता है जब आप लोअर फर्स्ट प्रीमोलर में कैविटी प्रिपरेशन कर रहे होते हो, राइट? क्या ये क्लियर है? आप और कुछ पूछना चाहोगे? Do you have any other doubt? Do you have any other doubt? या हम क्लास को एंड करें आप? So if you don't have any other doubt, let's end this class, right? कोई भी जो डाउट्स हो वो तुम मुझसे ऐप पे पूछ सकते हो. Okay then, good night.